So during this crisis time, mainly because of the pandemic COVID-19, everyone are worried mainly about what are the treatment options which are available for the COVID-19. As of today, we don't have any drug which we can say it as a drug of choice for the COVID-19 or approved drugs recommended by the Food and Drug Administration, that is FDA. But there are certain drugs which are being used by the licensed physicians mainly to treat the COVID-19 patients. As of now, we do not have any of the drugs as per se to say that these are the drugs which has to be used for certain type of patients. So what are the drugs which are floating around in the social media, as well as what are the drugs which are recommended by the clinicians, even though these drugs are not approved officially by the FDA. The first one is the Remdesivir, Chloroquine, Hydroxychloroquine, Lopinavir, ritonavir and Tocilizumab. So these are the drugs right now we are using for the patients who are suffering from COVID-19. So none of these drugs are mainly used as of now for the prophylactic treatment of the COVID-19, but they are used once the patient get infected by this novel coronavirus or suffering from the disease called as COVID-19. So first let me talk about the Remdesivir. So this Remdesivir is still under the trial. It is an investigational intravenous drug which has a broader antiviral activity that inhibits the viral replication by means of premature termination of RNA transcription. And this drug has in vitro activity against SARS-CoV-2, which is called as severe acute respiratory syndrome coronavirus 2. We will call this as COVID-19, and also in vitro and in vivo activity against related betacoronaviruses. So this is the drug actually blocks RNA-dependent polymerases. And there are several randomized trials which are in the process, or we can say underway, to evaluate the efficacy of the Remdesivir for moderate or severe COVID-19. But as of today, its clinical efficacy is not well understood. So this is under the clinical trials. In the description of this video, you can clearly go back to the link of the clinical trials and you can see at what stage this drug is under the clinical trials. And coming to the another drug, generally we use these as chloroquine or hydroxychloroquine, are the oral prescription drugs that have been used for the treatment of malaria as well as for certain inflammatory conditions. And especially when we talk about chloroquine, has been used for malaria treatment and chemoprophylaxis, and hydroxychloroquine is used for the treatment of rheumatoid arthritis, systemic lupus erythematosus called as SLE, and porphyria cutanea tarda. So both of the drugs have in vitro activity against SARS-CoV and SARS-CoV-2. SARS-CoV is also called as SARS-CoV-1, which means severe acute respiratory syndrome coronavirus 1, which was the old strain, and the new strain, what we are calling at present, the pandemic one, is called as SARS-CoV-2, which is responsible for the development of COVID-19 and also for other coronaviruses. So with the hydroxychloroquine having a relatively higher potency against this COVID-19 patients when compared to that of the chloroquine. But when we see both of the drugs, chloroquine and hydroxychloroquine, have been reported to inhibit SARS-CoV-2 in vitro, although hydroxychloroquine, as I already mentioned, appeared to have more potent antiviral activity. And the use of chloroquine is especially included in treatment guidelines from the China National Health Commission and was reportedly associated with the reduced progression of the disease and decreased duration of symptoms. However, the primary data supporting these claims have not been published in any of the articles, but other published clinical data on either of these agents are pretty limited. But in an open label study among 36 patients with the COVID-19, the use of hydroxychloroquine was associated with a higher rate of undetectable SARS-CoV-2 RNA on nasopharyngeal specimens at day 6 compared with no specific treatment. So in this particular clinical study, the use of azithromycin in combination with the hydroxychloroquine appeared to have a much more additional beneficial effects on these patients, but there are methodological concerns about the control groups for the study, and the biological basis for using azithromycin in the setting is pretty unclear as of date. So despite we are having a pretty much limited clinical data, given the relative safety of the short-term use of hydroxychloroquine, the lack of unknown effective interventions, and in the in-vitro antiviral activity, some clinicians think that it is reasonable to use hydroxychloroquine in hospitalized patients with severe or risk of severe infection by the COVID-19, and if they are not eligible for other clinical trials. And also the possibility of the drug toxicity, especially when we use this combination, we may develop, the patients may develop QT prolongation and retinal toxicity. These two important toxicities can be considered prior to the using of hydroxychloroquine, particularly in the individuals who may be more susceptible to these effects. And there are also no currently available data from the randomized clinical trials to inform that the clinical guidance on the use, dosing, and the duration of the hydroxychloroquine for the prophylaxis of the treatment of the novel coronavirus 19 infection. Although the optimal dosing and the duration of the hydroxychloroquine for the treatment of COVID-19 are unknown, and some of the US clinicians have reported the different hydroxychloroquine dosages, such as 400 milligrams twice on day 1, then daily for 5 days, and 400 milligrams twice on day 1, then 200 milligrams twice for 4 days, and then 600 milligrams twice on day 1, then 400 milligrams daily on days 2 to 5. Like this, we have various clinical trials which has been prescribed over here. So whenever during the prescription they will mention 400 milligrams BID. So on the prescription, whenever you say BID, which means twice, 2 times a day, it is an abbreviation for bis in die, which is in Latin terminology means twice a day. So in the description, again, you can see the clinical trials link where you can clearly see what is the status of the chloroquine as well as hydroxychloroquine on the randomized trials. And the treatment of moderate to severe coronavirus disease in hospitalized patients. So especially for these individuals, there are several drugs which have been using and also currently under use, that is Lopinavir, ritonavir, as I already mentioned about hydroxychloroquine, sulfate, and baricitinib, that is Janus kinase inhibitor, and Tocilizumab, which is anti-interleukin 6 receptor, or we can say anti-interleukin 6 drug, we can say. Out of all these, Tocilizumab, which is most widely used by the clinicians, but the treatment guidelines from the China's National Health Commission include the interleukin 6 inhibitor, that is Tocilizumab, for the patients with severe COVID-19 and elevated interleukin 6 levels, and this agent is being evaluated in the clinical trial. And this Tocilizumab is still under the investigation for the COVID-19 pneumonia, and the drug is actually given by the form of injection, and at present it is under phase 2 clinical trials. And the inhibition of this particular interleukin 6 receptors by Tocilizumab leads to the reduction in cytokine as well as acute phase reactant that may have a beneficial effect in this COVID-19 patients. So the link description, you can see in the description box of this video, you can see the status of the clinical trials. Because why I have given the link description for each and every drug? Because you can see all these drugs which are not approved by the FDA but can be used in the treatment settings because you don't have any treatment options which are available, but all the drugs are still under investigational trials. Lopinavir and ritonavir. So these Lopinavir and ritonavir appears to have little to no role in the treatment of the SARS-CoV-2 infection, that is COVID-19. But this combined protease inhibitor, which has primarily been used for HIV infection, has in vitro activity against SARS-CoV-1 and appears to have some activity against MERS-CoV, which is Middle East Respiratory Syndrome, in animal studies. But however, There was no difference in time to clinical improvement or mortality at the 28 days in a randomized trial among 199 patients with the severe COVID-19 given Lopinavir, ritonavir, that is 100 milligrams twice daily for 14 days in addition to the standard case versus those who received standard of care alone. So this is the official link in the description what you can see regarding the FDA link. You can see regarding the Lopinavir as well as ritonavir. And this Lopinavir and ritonavir did not show promise for the treatment of hospitalized COVID-19 patients with pneumonia in a recent clinical trial in China. And this trial was underpowered, and Lopinavir, ritonavir is under investigation in a World Health Organization study. And mainly what is important is all these are the drugs. These drugs are used by the clinicians. You cannot use these drugs as an individual taking directly from the counter, or you cannot use any of these drugs as a prophylactic treatment. Only when you are at risk or only when you get the infection, once you get hospitalized, the physicians or the doctors who are in the clinic are going to give you by saying your age, symptomatology, by saying the risk factors. There are so many things which need to be taken under consideration before giving the treatment. So I advise each and every individual, do not buy any of the drugs directly from the counter and do not use it as a prophylactic treatment or use it as like individual treatment when you develop COVID-19. You have to admit in the hospital and you have to be in quarantine for 14 days at any cost under the medical supervision, and especially to reduce the risk of transmission into the community. So all of the individuals should be advised to wash hands diligently, practice respiratory hygiene, that is cover their cough, and avoid crowds and close contact with ill individuals, and if possible, and face masks are not routinely recommended for asymptomatic individuals to prevent exposure in the community, and social distancing is especially advised at present, particularly in the location that have the community transmissions. So this is what you need to know about what are the treatment options which are available right now for COVID-19.